Bonjour à tous. Bienvenue à ce séminaire de BPH et SPET. Aujourd'hui, on a l'occasion de travailler, de voir ensemble le travail avec les collègues GROVÉ et Alexandra MARINUCCI, qui travaillent avec moi, avec le centre en général, sur la santé mentale des jeunes. Et aujourd'hui, elles vont nous présenter plus spécifiquement la théorie de la littératie en santé mentale. Et Alexandra et Christine sont surtout des chercheuses en sciences de l'éducation et psychologie du développement. Donc, merci beaucoup d'être là et the floor is yours.
Thank you. Merci beaucoup. Apologies for our terrible French, but we will be talking in English and hopefully some of the translation will help a little bit. So thank you so much to our colleagues for translating some of the slides. We will try to have questions at the end, so if you do have any questions or concerns, you can ask us at the end as well. So today we'll be covering our research area and also an area we work clinically as psychologists. So we'll be looking at youth mental health literacy, and we'll be also focusing on not just the young person themselves, but also their community. So their parents, their teachers, maybe even their doctors as well. We all have a role to play in the well-being and mental health of young people. So in Australia, we usually do an acknowledgement of country where we acknowledge and respectfully acknowledge the ancestors on which we created this presentation and on which we do our research. So if there are any elders in this room who are joining us from Australia, we acknowledge you and respect you as custodians of our land. So this is us. We've been doing this work for almost a decade now, with clinically and then also in research. So we're very excited to be here in Bordeaux, to be sharing in a collaboration with our colleagues here, and then also to share what we found in Australia so far, which some of it's similar to French experience and French culture, but then some of it is also quite different. So looking forward to sharing that today. In terms of our current research projects, we are looking at a school-based intervention, quite specifically in our partnership, and we have had some funding come through for that, which is great news. And then we've also published some of this work, just to show that it is valid, that it has been reviewed externally to us as well. So our agenda today will briefly cover mental health literacy. What is that? We'll look at it across a few different populations. We'll include university students, so yourselves in that as well. We'll also look at age-appropriate or developmentally appropriate interventions and how you evaluate those as well, and then finish off with some reflections, any questions that you might have as well. And if I'm talking too fast, please just let me know. I can sometimes get like on a train and go very fast. So in good news, the evolution of mental health has changed, which is fantastic. Back in the day, it was very much very focused on psychiatric conditions. It wasn't as multi-tiered as it is now. Previously, we understood if you had a challenge with depression or anxiety, you might be experiencing something like psychopathology, and you'd often be locked away in a very scary situation. That has changed now over a really long period of time, thankfully, and we're looking at now understanding mental illness and mental health along a spectrum, along a continuum, and that this changes throughout one's life, from when you're really young to then when you are an adult, and in later life as well. We experience mental health differently. So it's great to see the field of research move away from being so traditional, to see that we might experience a mental illness in our lifetime that's really clinical. We might improve from that, but then we also might have good days and bad days within that dichotomy. So it is no longer understood as only the presence or absence of mental illness. And that's a great advancement that we've seen in our time. In terms of understanding the concept of mental health literacy, it's moving away from just saying, do you have schizophrenia? Do you have a mental illness? But looking at understanding, what is mental health? What are disorders? What help might you need if you have that condition? But then understanding how your mental health works. What is your individual personal well-being? And then how do you maintain that? How do you keep that up? How do you seek help if you do need support? And then how do we decrease stigma related to mental health conditions? So what often happens that we still see now is even though we've improved our understanding of mental health, we still do not see help seeking or people seeking help at all. Often it's still seen in this negative lens as very medical and negative, and it's not treated the same as we might a medical condition. A lot of young people we work with will say, when my mum got cancer, everyone came and brought me food. But when we got a mental illness diagnosis of depression later in her life, no one came to the house. No one helped us. And so there is still a very big stigma issue that we see related to mental health, even if it has changed and evolved over time. So why is it important? Well, the World Health Organization says that this new framework will now help us transform services and policy. I think for you in public health and in the space, it might also see mental health as comorbidity with other conditions. If you do see clients or patients, or you do work in systems where there is no mental health or wellbeing policy, to see that they do come together, there are comorbidity in there as well. And it's helping us focus on maybe population-wide well-being as well. So what is the population of Bordeaux in terms of their mental health and well-being? Are the social economic factors supporting the mental health of our community? And if not, how can we support them through holistic care? So make sure that we have services to support that. From what we've learned from our colleagues, there's a lot of growth that needs to happen in France around responding to this change in how we understand mental health with services and public policy to support that holistic person, their well-being as well as their physical health, as well as their medical health as well when you see a doctor. It is also upholding the human rights of a person. If you go into the detail of that, it is now considered a human right to have access to mental health care and support as well. And a really important component of this transition to understanding this new mental health literacy and this new model is that people who have experience of mental illness, whether they're children living in a family with a mental illness or they have a mental illness themselves, are empowered to participate in our community, are included, are at university, are becoming doctors, are psychologists, because that lived experience is just as critical and as important to include rather than what was previously happening where they're ostracised or excluded from our communities. So thank you so much to Lisa for translating our model. One of our models we created specifically to children and young people. It is translated in French and we have published it. Covers key areas of mental health literacy and areas of how do we actually help the mental health and well-being of young people. I think what we've just discussed now, that first one is looking at recognising the changes in mental health is really clear. This is the English version. Yeah, I can't speak French. And then the second one is help seeking. So I think that's really clear where to go to seek help. The supports available of professionals as well. And then some areas that are newer to the field, which is the second component there, looking at environmental influences. So how does the family influence your mental health and well-being, your biology, so what you were born with as well, and your hereditary impacts that happen, and then your social influences, where you were born, what your postcode is, that also has an impact on mental health. So that's really clear to show that it's not just the individual and their mental health, but a system around them that impacts that mental health. And so that's why public policy is so important, because it puts in the centre, making sure that people are able to feel well and do well as well. The next area is coping and resilience. So looking at how you communicate and talk about mental health and well-being in your communities, having a pretty healthy lifestyle. A lot of the young people we speak to in our research will use unhealthy ways to cope. TikTok is a really popular way. They go to get ways to be well or learn to be well, and often it is not helpful. It is inaccurate ways of coping. And then lastly is attitudes. So how do we actually address someone if they tell us they have a mental health concern? How do we communicate and respond to them with that? And a really important factor is help giving. So giving young people the opportunity to volunteer or to give back to their communities, that's been seen as an important protective factor in improving mental health and well-being. Interestingly, some of these factors will be really helpful for university students as well. So I know for our students, my students at university in Australia, peak times of stress around exams and assignments, it can be really difficult to manage a healthy lifestyle. It can be really difficult to maybe not be up all night to get your assignments finished. But the research shows to try and maintain as much of your normal routine as you can in those peak moments of stress, is the most beneficial. But we understand that, of course, in life, there are peak periods of stress, and sometimes that does build, which is one of the pillars here, resilience. You learn to cope with multiple demands, and sometimes it can be too much, and that's where seeking help in those moments is really important. So interesting to note around the different types of information we need across different ages. So I just shared there for university students, it's a very unique situation and services university students need, managing multiple demands, assignments, assessments, lots of new knowledge coming in that can have an impact on well-being. But we know for children and adolescents, their knowledge around mental health is very different. Often children know there's something going on, they know they might have a concern around their mental health, they're not feeling good, or their parents unwell, but they don't know what to do with that information. They don't know how to interpret it. And often they do require a tailored intervention. So that could be something from a psychologist, or what we're seeing more commonly now are school-wide interventions and programs, which can be preventative, which we'll be talking about today, and that's the work we do with Ilaria. Adolescents need identifying more specifically some mental illnesses. So the most common ones, like depression and anxiety, and we find that they have a much varied experience of mental health. So they have quite a fluctuation within that as their hormones change and their behaviours develop and change as well within their identity. We do find that they're the least likely group to seek help. So if they are struggling, they're not going to tell you. They're not going to ask for help. You might see them calling out for help in their behaviour, which is often what we'll see in Australia anyway. And then stigma has a really big impact for young people to seek help. They don't want to be looked upon poorly in their social circles if they do talk about mental health challenges. Really interestingly, our research showed that parents actually have a higher expectation of their children's knowledge of mental health. They expect their children to understand mental health and not have those conversations with them, but actually the children say, we do want to talk about it. We want to know more. What is happening, with our mental health? And we also found that culture has a really big impact in families too. Is it taboo to talk about mental health and well-being? Is it just work, academics only? And that can be quite a stressful environment for young people and parents as well. And then teachers have varied mental health skills to be able to talk about it with their students. And that includes university lectures too. There's their knowledge and confidence to support a person experiencing a mental health challenge, we finding is quite low. They lack the resources and skills to be able to have that conversation or offer that support. And so through our work, we're hoping to change that and put that on the agenda and make it important so that we can have higher mental health literacy in our communities.
Okay, so how can we increase mental health literacy for young people? The literature does show that different sorts of evidence-based interventions are important, and this can be, which we will go into a little bit later, age appropriate and developmentally appropriate. So for children, it might be more story-based, play-based compared to what you would do with adolescents. And we need to do ongoing assessment of student mental health needs and include their perspectives and where they are at in tailoring the intervention to them, making sure it is relevant to them as well. Another thing is to train teachers in youth mental health so they can look out for any sorts of signs where they may need to refer them on to a mental health professional. And then lastly, to increase mental health literacy for young people, we need to increase awareness of mental health in the school environment, and that can be through whole school interventions, it might be through individualised intervention, but increasing that awareness and those conversations about mental health in schools and in universities as well. another way is we need to increase accessible services, and that means also teaching young people how to access these services. And that might be, for example, when we ran a program, is consulting a school of, can you show them actually how they would make an appointment with a psychologist or a school counsellor, because they may have been shown at the beginning of the school year and now forgotten. So it's ongoing throughout the school year, making sure that students are aware of the help that is available and normalising that it's there and that they can seek it if they need to. School-wide preventative approaches, so that is the core of mental health literacy, is trying to take a preventative and promotional approach to educating people about mental health and how they can look after their mental health. So it's not a diagnostic or intervening when they've reached that point of a mental illness. It's rather preventative and taking that sort of approach across a whole school or a whole university. And then lastly is also collaborating with the key stakeholders. So making sure the information we're providing is relevant and adequate, and that's something that's ongoing. We need to constantly be talking with the people that these awareness campaigns or interventions are targeting and making sure that it's still appropriate and adequate for them. For parents, literature has found that it's more, we can provide mental health literacy more generally, but also for particular illnesses and disorders like eating disorders and depression, so that they can look out for when these things may start to develop, particularly in the adolescent period where we do see that hormone change, and that really does impact mental health. And so parents being aware of certain behaviours that they may need to look out for in case they need to intervene or seek that support for their child. And this can be done through websites, podcasts. There's been workshops that have been done through community services like sports clubs and schools. That's been beneficial. So places where it's accessible to parents as well. And then there's also been literature of programs where parents and children attend together. And so that might be around a particular mental illness, particularly if it's a child of a parent with a mental illness, so they want to learn about that parent's mental illness and become more aware of that as well. So it's that learning together and awareness together. And then for teachers, so again, we want evidence-based intervention and collaborative problem solving. So that means talking with teachers about what they're seeing on the ground and where we can help build their awareness. And so it's always about involving those key stakeholders, so teachers, parents, young people, in developing these sorts of programs or curriculum or interventions, and helping them increase their understanding and fill those gaps in knowledge that they have that's going to be accessible and appropriate for their level of knowledge right now. When we want to increase it for teachers, it's also including administrators, making sure it's logistically possible as well. And so it might be embedding this sort of training in their university course. So adding it as a subject that they can take to increase their mental health literacy. And that also requires some support from mental health workers to advise on what sort of information might be important there. So it's really all about coming together as a team to making sure that we can increase that mental health literacy, across different sorts of populations.
So how have young people in our studies defined mental health? They came up with some core areas in our research of how they told us mental health and what it is. And for us, they said it was having a balance between emotional needs, mental needs, as well as emotional needs of their health. that they didn't want to feel isolated, but having a balance across life challenges and resources, so that balance is really important. That we all have a unique experience of mental health. So all of our journeys are individual, and so taking that into consideration when we're creating programs or interventions, that we might each have our own perception and our own life experiences that shape our mental health and well-being. And that could be influenced by the environment as well. So often lots of programs don't consider that. They don't have an understanding of being able to provide something that is unique to varying needs of mental health and well-being of a young person. And also looking at mental health as a vital part of your health. Often we only see health as physical, and they report that in school they always get asked about how they're going health-wise, are they into sports, what activities are they doing, but actually considering their mental health and belonging and sense of connection just as important as sleeping well, as eating well. And yeah, so that for them it was really important to have that equal consideration of mental health within healthcare and within health. They also describe mental stability as a state of being, which was really interesting, that allowed them to have moments of struggle, that allowed them to have moments of hardship and adversity in their life experiences. So instead of saying, well, we always need to be happy, life is always about being good, instead we kind of have a state of being a person, of being, and within that we have adversity and then also our good moments. So they thought that you don't always need to be in the perfect right headspace to make decisions, and that sometimes, you know, we've got to work to be able to be in that right space, to be able to do that as well. They also indicated that having connections was really important, so actually having a peer circle of friends that they could get along with and trust and connect with, who were positively influencing their lives was really important, and that's quite commonly reported in the literature, but it was really noted by the young people that had one of the biggest impacts on their mental health and well-being, and it should be considered a key component of how we understand a young person's mental health, which developmentally, as a developmental psychologist, that is true. It is, you know, accurate in terms of their developmental growth and changes, that friendships become more important than their parents, more important than their teachers during this age. So it is important we consider that when we understand and define young people's experiences of mental health. Just a few ways that we might assess their knowledge and understanding of mental health and well-being. It's using age-appropriate methods. So you might use a narrative, play-based interviews, storytelling, visual methods as well, like cartoons. Digital platforms are really important. And Ali will go through a couple of examples now.
So this is just some of the research on some developmentally appropriate interventions particularly for young people, like adolescents and children. So there's the Moving Stories program, and that's a game-based program particularly targeted for depression. And then there's also the Stigma Stop, which is another game-based program, and that is more targeted towards the stigma aspect of mental health literacy, so reducing that stigma. And then there's the photo story method, so that's for Kids Matter, and that's something that was brought into Australia quite a while ago now, but it's just another example of how there's different sorts of platforms and methods to help teach children and young people about mental health. And then these are two other different examples. So I think it's Mood Hub is, I guess, a website that people can access, and it's got different sorts of information, and you can set, you know, goals and things like that. And that's just a different sort of way that you may intervene for mental health literacy, and that's more also targeted towards depression. And then lastly, there's a comic book. So that's, you know, a comic book sort of intervention. So that's sort of story-based, can be really good, particularly for young people and children. So we've done some research around what young people are reporting in terms of mental health, and they are reporting that mental health is similar to physical health, so it should be given the same level of attention. Particularly in the school environment, there's been a lot of, previously lots of health promotion around in Australia, for example, it's around sun protection. And so that's really heavily focused on in Australia. But mental health hasn't been given that same attention. And so now we're moving towards that approach of it should be given the same level of awareness, same level of intervention and attention in schools because it's just as important. And they do understand, and we did some interviews and group interviews, that mental health is more than just illness, which is similar to, it is the World Health Organization definition of mental health, that it isn't just, the absence of illness is a holistic view of it includes how to look after your mental health and keep good mental health too. And that stigma is increased by not talking about it. And in schools, we're now, particularly we're moving towards increasing that awareness and talking about it more so we can decrease that stigma. But it is something that will take time because there's the cultural sensitivity and across generations, there's that attitude shift that we're starting to see now. But so saying, you can go to this website isn't enough. We want to show them how to do this and how to access and where to go, rather than assume they'll be able to figure all of that information out on their own. So making it really clear on how they can access certain resources, how they might go see a psychologist, what that process actually means in their school environment or context. At university, how do you actually find that website or go to that office where those resources and supports are for you? So having, and different sorts of resources as well. There might be a website, there might be a program you can attend, there may be posters so that it's all available and accessible.
So we also found that the delivery of programs are really important. So who are the people who are providing these services? They need to be personable, they need to be quite engaging in how they connect with young people. Otherwise, they just will disengage and not connect at all. So they do need to have that relatableness in their presenting style or in the way they connect with young people. And that is quite specific to the adolescent developmental phase as well. So they don't want to feel like they're being spoken to like a parent or getting in trouble by attending a mental health and wellbeing program. The timing also needs to be appropriate within their school calendar, within their school term as well, and particularly maybe at peak times of their adolescent journey that they might need to have mental health knowledge. So, for example, an 11-year-old might need very different information to a 16 or 17-year-old, and as well as their teachers and parents. So we need to make sure that the information is relevant as well, and that there's not continuous overlap. So a lot of young people report that there's constantly the same information about depression and anxiety, the most common mental illnesses, that they get time and time again. And so this isn't helpful, and they actually find that they need to grow with the mental health knowledge they receive from teachers and educators, but as well as from programs as they develop from being a youngster in primary school age to then in secondary school, and I would argue also for university students as well. So I'll briefly go over this slide, but making sure it's age appropriate. So often people will say to us, well, we don't want to talk about mental health with young people. 8 years old is too young. But actually our research is showing that they are getting access to this information, they're learning about it, they have awareness on it, and it's better for their own mental health and well-being to discuss it and talk about it and have those open conversations. In Australia, I don't know if you've seen in the news, probably not, we're so far away, but we're having crisis levels of mental illness in our young people's community, and that's an impact from the pandemic. So we've had serious lockdowns, some of the most serious ones in the world, where we weren't able to leave our houses for 2 years. And it was a very serious situation for young people. We had military in the streets, and they were following us on Google Maps, so they could see, which suburbs or areas were, trying to leave their homes and their houses. And so for young people, all of the things that help their mental health were impacted, were jeopardized. And so that was such a critical time of life for them. So making sure that interventions understand that we're in a post-pandemic world, we're in a culture where we have really high levels of mental health challenges in our young people, and we need to be able to address that in a meaningful way for those young people as well. And looking at the effectiveness, what we often will see is a rollout of a program or an awareness, yes, let's get this out there, but then we don't see any evaluation. We don't see any research around, is it actually working? Is this targeting the right young people? Is it helping them? One of the challenges we find is that some programs can do more harm. They can actually be, cause more challenges. So making sure that it is fit for purpose and that we're offering the age-appropriate program and also the life stage, that they're at as well. Is this you?
Yes. So we've also consulted school staff, such as teachers, and administrators like principals at schools, and then allied health professionals, so psychologists, social workers, of how we could increase mental health literacy in a school environment and what would be needed. And so both groups, both populations reported that many programs that are being used, and this is in an Australian context, but they're not evidence-based. There's also limited resources and lack of training. And so a busy curriculum also presents barriers to actually being able to include mental health literacy curriculum in the school and having a teacher teach this. And so they do also identify that mental health education is a need, and that they do want young people to be able to build practical coping strategies, particularly how to manage stress, in those busy environments, particularly in the upper secondary school years where there's exams and there's those peak levels of stress, just like in university, but so how to actually cope with that stress. And then also awareness of help options and the ability to recognise when they are experiencing a decline in their well-being. So being able to identify that within themselves, that I'm starting to experience low mood and all those sorts of indicators, and being able to intervene or or talk to someone about that before it gets into a point where they may start having a depressive disorder and it needs that higher level of intervention. So we're trying to get in before we get to that point where it develops into a mental illness, mental disorder, and being able to manage that earlier on. But educators, so teachers and principals, did report that they're not feeling competent to support youth mental health and wellbeing. So where to from there is upskilling and training and working alongside mental health professionals to help support increasing mental health literacy in schools. So we've just put this slide up to talk about the difference between curriculum, program and intervention in mental health literacy, because we see all these in the literature. And so for mental health literacy curriculum, it's more structured and organised. It'd be embedded into a school or university year, and it's to increase knowledge and understanding of mental health for the general population. So an example is the Canadian curriculum called the Guide, and that's implemented in schools. But it might also be, a whole year general mental health literacy education. A program can include a curriculum, but it might also include peer support or counselling services. Might be a little bit more targeted towards certain sorts of illnesses, so potentially depression and anxiety as the most prevalent mental illnesses. And so it's more to create a supportive environment to talk about mental health, provide the resources, and so it's more general. Whereas an intervention, it might be really targeted towards one mental health need. So it might be more of a depression literacy. So it's focusing more on depression, and it may be because there's these students that are presenting with low mood. And so we want to try and potentially intervene there, and it might include aspects of therapeutic approaches like cognitive behaviour therapy. So one program, which is what we have researched in Australia and form part of my PhD, is the Youth Education and Support Program. And so this is 10 sessions. We adapted a manual for it, and we recruited students on an opt-in basis. And this was delivered by Masters of Psychology students. So we trained them up and supervised them throughout. And there were small groups of secondary students, so they were 13 to 17 years old. And this was created by Dr. Joanne Riebschlager at Michigan State University, and then we adapted it, so myself, Christine, and Dr. Kellyanne Allen. And this was also informed by the Universal Design for Learning and aligned with the Australian Health and Physical Education curriculum, and based on the child-focused mental health literacy model. And so we did find that there were increased mental health literacy from pre to post of the program. There were improved attitudes, and general coping strategies was more healthy, and there was more understanding of those coping strategies that would be tailored and helpful for each individual student. And then there were also decreased negative attitudes around mental illness and those who do experience mental illness. So what we did learn from that study was that it can be reduced to 6 sessions. 10 sessions was too much. And it could potentially be delivered by teachers if we provided training to them and, I guess, advise them along the way as well.
We're almost there. Thank you so much for your time. So one of our studies that we've published did report that we need to look at the sustainability of these programs as well. So Ali's done an incredible PhD on this program, but now how can we keep supporting those young people who now have increased mental health knowledge within the school system? And then what about the next students that come through as well? How do we support the high levels of mental health literacy once we improve them? So we need to make sure we're incorporating that into practice. It's great to have an intervention in a program, but where is the research and the evaluation to support rolling out that program, particularly on a school-wide level? Schools are struggling in Australia in particular, and so often they'll just grab a program to try and address some of those issues they're experiencing, but there's no quality research to support running that intervention with young people. So making sure that we do have more quality research to support that as well. And then to evaluate how feasible is it actually? Is it expensive to run? Are young people enjoying it? Would they recommend it to their friends? Do they want to come to the intervention as well? Are they attending? So a few of the key factors are making sure that you have valid scales, so robust scales to measure the evaluation, so you know that what you're measuring is actually what you're measuring. So if you're seeing an improvement in mental health, we hope that when you use a scale, you're actually making sure that that's improving, rather than maybe increasing an illness in young people or other concerns. So making sure that it's actually doing what it's supposed to do through those measurements. Making sure that you do, in some cases have a control group. It's considered the best research, but there's a lot of debate on that nowadays. Is a control group really the best way to to evaluate a school program where there's so many variables within that school that make it challenging to do a control group? Having details of the intervention. Often, folks will talk about a program but not share the actual program. So how do you know what that program is actually about? Does it come from that traditional model? Is it medical? And you can't evaluate that unless you actually see what that program has to offer. And this is the nuance in the field, like the small detail, I think, that can make a program effective or not effective as well. And then, does it have long-term effects? So if you're running a whole school program, is it actually going to still be beneficial when they're in later secondary school and in year 12? So in wrapping up our last few slides, some of the concerns in the field: what happens when we support a young person's mental health and they go back into their community where the mental health literacy is really low and stigma is high? what happens to that young person. There are clinical risks with some interventions, so often what we're seeing commonly happen now is clinical interventions that a psychologist will run one-on-one with a patient are being offered on a school-wide level. And in our clinical opinion, that's not appropriate to offer a clinical cognitive behaviour therapy intervention to 20 students when it's designed to be one-on-one work. Ensuring that it is age appropriate across the lifetime, and we need different interventions for different age groups. So having a school that does one program isn't sufficient for all of the students within that school. And there's often misconceptions. If I talk about mental health, am I making it worse? Am I triggering it? And research shows that that's not the case. It's better to have those conversations and over time. And really important to work with folks like you in public policy. So if you see something around, anything in your area of specialty that you think, oh, does this have a mental health impact? Should we consider what's happening for this person in their community, or what is the agenda here? Is there a mental health impact? Because research has shown, for example, in academics, if students are connected, if students have strong mental health, their academic results improve dramatically. So that's some really helpful research to show the ripple impact of feeling connected and having high mental health literacy skills. At the moment, we're doing a 10-year study of the mental health of Australians, and we're looking at teachers and parents and young people, and we're just looking at the generational shift of mental health knowledge. And it's been really interesting to see that change over time as well. So that's really helpful to inform public policy as well as the government agenda. So what next? It's so important that we have psychologists working with public health experts, with public, people in education and biostatistics. We need to come together to address this issue and no longer work in silos in our individual area of expertise. We won't address this problem unless we work together and look at it from different perspectives. We need those different viewpoints so that we can then create, improved supports and services for young people and the community as well. And then we do need better measures. Ilaria's team are doing an incredible job translating measures, making them appropriate for France, and then evaluating them. So that's a really great first step to see, is this, is what we're doing working? Is it right? And we are currently looking at a worldwide project across a few countries, which is really exciting, to look at mental health and programs and ways to evaluate those. So it's almost like we're creating an international database of mental health knowledge and seeing how that changes culturally between the different countries, and what supports can we offer in a more of a worldwide sense as well. And of course, as always, publications, we need to make sure that our work's evaluated externally and getting it out there further than just our academic walls. So it's amazing that you're here. Thank you for your time, because this is an example of sharing what I do in my office with Ali in Australia, but in here now, with you in this space. And then, of course, funding. Unfortunately, our field gets the least amount of funding out of all of the fields, like the medical research fields. They tend to get a lot more funding. And it's easier to measure a medical result versus, let's say, a mental health result, which might take many years to see improvement. And so they often get a lot more funding, and we're fighting always to be considered for any kind of funding as well. So I really appreciate your time. Very generous of you. Thank you so much. Very kind. Any questions? Thank you. Well. Yeah, your water is well.